we're all learning, actually. Put this in here. You can put this here so you can see. This doesn't move. I think we're okay.
Can you hear me, Dr. Gordon?
Oh, yeah. We have to put this here. Okay. There you are. Okay, we can see your face, and you can see our patient's wrist.
Yes.
So this girl fell on a... she fell this way, not on an outstretched hand, but actually on a supinated hand.
Okay.
And she's having pain circumferentially around the wrist. No one point is more tender than the other.
Okay.
And there's no observable deformity, no observable skin breakdown, laceration, or abrasion.
Good. Any swelling?
Not really. Just from this, I mean, it just happened this morning. This morning. Okay, so that's enough time for there to be swelling, but I don't see any swelling. You don't get a sense that there's significant swelling yet.
Good. So there's a couple of different ways we can go about this wrist evaluation. So first, we can look at the long bones to make sure there's not a fracture.
Okay, great.
To first look at the long bones, you want to set your butterfly preset to musculoskeletal or soft tissue.
So I'm going to unfreeze. So now it's live. Then we're going to go to preset. Does it matter between musculoskeletal and MSK soft tissue?
No, they're both.
That's two different options. Okay. So now I've got this shallow. Go ahead and put it on, just so you can start seeing. And you've got, oops. I'm trying to hold it so you can see it, but also so we can see it.
Okay, great. So bone is going to be this bright white at the bottom here.
Yeah.
And what we're looking at is going to be, this is her distal radius, and then over here is going to be the ulna.
So, do you want me to change my view and come over this way? Is that helpful?
Yeah, that's great.
Okay.
So to look at for a fracture, especially like a distal radial fracture, the first thing you would do is you would look in two different planes. So you have your ultrasound kind of pointed transverse or longitudinally.
You come over here.
And you would scan up and down the wrist. Along the length of the wrist.
Yep.
Okay, so you're getting a cross section through the bone.
Yep, and so what you're looking at is you're looking for any jagged break or cut off along the bright white line of the ulna, which is going to be here on the ulnar side of the wrist, or on the radius, which is going to be on the radial side. So go ahead and slide the ultrasound more proximally once you have that bone centered. Yep. And we're watching to see if there's any break in the cortex of the bone, especially in the area of interest. So continue sliding this direction. Yep, just slide. Very good. You can see the radial ulnar joint widening here. Great. And we don't see any breaks on the cortex of the bone, so now we can go to the radial side. We can evaluate her radius. So again, kind of starting distally at the carpal bones, very close to her wrist crease, and then going proximal again.
Right there.
There's the scaphoids, yeah, and just gliding along to make sure there's no break in the bright white cortex. Make sure it's all nice and smooth.
Let's see.
And do you want to hold this? Why don't you?
So as you were looking through the radius, did you see any breaks in that radial cortex?
Not really.
That's great. So ultrasound is really, really sensitive for picking up breaks in long bones, like a radius or an ulna or a femur or a tibia. If you see a break, and I'll send you some pictures a little later of what a broken bone looks like, just so you kind of have a good idea what you're looking for. But it'll be a step off or a break in that bone. Now, the downside of ultrasound for fractures is that it doesn't tell you what the whole fracture looks like. It just tells you, is there a fracture, yes or no. It doesn't tell you what the fracture looks like. So it's still helpful to get an x-ray later, but an ultrasound is a really great way to rule out fractures in a place where someone's really tender in one place. So if someone, say, twists their ankle or lands on their wrist, and they say, hey, it hurts right here, you can make sure there's not a broken bone right there where it hurts. So it's actually very sensitive for that.
Okay.
And so I think, we've looked at the volar side of the wrist. It would be good to look at the dorsal side to also make sure there are no fractures on that side of the wrist as well, especially younger kids, like who are going to be 5 or 6, they might have a green stick fracture. And so you want to look at both sides of the bone.
Okay.
Okay, cool. So inspiring.
Very.
Esther, do you want to give it a try? So you're right-handed?
Yeah.
Left-handed, okay. So why don't you hold the phone, because you're going to control where the camera is, and then this hand is going to control where the ultrasound goes. It's frozen right now, so it's not actually transmitting ultrasound. But you're going to put the probe on, and then we can unfreeze it and then put the probe on. You ready?
Yep.
Okay. So how do you want her to approach for joint diffusion?
So I usually start transverse. And when you hold the probe, you want to hold it all the way down at the neck of the probe and maybe put a finger or two, like your pinky, on the patient's skin. And that'll help you stabilize your probe so you have a lot more control. There you go. That's perfect. Okay. And then as you're scanning this wrist, you want to look for the tendons. So again, you'll see tendons in your picture. So those will be kind of the bright white circles or bright white oval pictures on the top. And Tony, do you have a anatomy book? I thought I saw you moving one around.
Yeah.
If you have a picture of a wrist in cross section, that might be helpful for looking at the tendons there. So when you're looking at the tendons in the back, they're grouped into different groups. There's 6 groups of them, but basically you just kind of look back and forth at those tendons to make sure that everything looks consistent with what you're seeing on the anatomy textbook. Then you find something called Lister's tubercle, and so it's something you can actually feel on the back of the radius. It's this bump. So if you put your finger there, you can feel it. Or as you're looking with the ultrasound, it's going to be this kind of peak, white peak, and that's called Lister's tubercle. It should be somewhere around here on her wrist. Yeah. Do you see the white peak on the ultrasound? I find that that's probably the best place to start looking for a joint effusion is on Lister's tubercle. Once you find that white peak, you put that in the very center of your screen, and then you rotate 90 degrees. Yep. And now what you're going to see is the radius is going to be the bright white line. And then I'm going to actually adjust your depth a little bit so that you don't have as much dead space there. So 2 centimeters is probably great for this one. So you can see the radius, and as you scan back and forth, scan a little bit closer to her hand. Yep, so go towards her hand. You're gonna, the radius, the bright white cortex, the radius is gonna drop off, and you're gonna start seeing the carpal bones. And so that kind of space in between the radius that's up here and the carpal bones is where you're gonna have a joint effusion. So right now, her wrist looks great. So she's got a nice bright bone here, a nice bright bone there, the carpal bones. But if there's a big black space here that kind of appears, then that would make you think that she's got an effusion within her joint, either from a broken bone or an infection, or if it was from, someone who's got arthritis. Someone who's older and they have arthritis, they can have a joint effusion. So that's the space to look for a joint effusion in the wrist. Her wrist looks great. I don't see any broken bones and I don't see any torn tendons, so that's good.
Hey, that is awesome. And if we're able to develop that skill over time of ruling out fractures in some of these kids, that can save a lot of trips to the nearest hospital with an X-ray machine.
Exactly. Yep.